When planning to get pregnant, it is common for people to want to know their partner's genotype and all of that. But there is something that is really important that we usually overlook, which is Rhesus Incompatibility. In today's video, I'll be talking about everything you should know about Rhesus Incompatibility. Stay tuned, I'll be right back. If it's your first time here, this is Motherhood Journey with Abiola. If you like this video and you want more content like this, ranging from pregnancy to postpartum lifestyle and motherhood in general, drop a comment on this video and ensure you subscribe to this channel. Let's build a team of mothers and even fathers that make a difference. Rhesus Incompatibility is very important to know because this has a lot of adverse effects that can affect your pregnancies in the future time. Now let's talk about this. If you have a blood group A negative, B negative, AB negative, and O negative, and you are getting married to a positive blood type, there's something you need to do in order to ensure that nothing happens to your pregnancies, your future pregnancies. Now, this is it. If a woman carrying negative rhesus factor gets married to a man carrying positive rhesus factor, the baby is likely to have the mother or the father's rhesus factor, which means your child may either have rhesus negative or rhesus positive. Now, if your baby has rhesus negative, there is no problem. But the problem arises when you have a baby carrying rhesus positive. Now, there is something called sensitization. This happens when a woman carrying a rhesus negative blood type gets pregnant for a rhesus positive father, and the baby happens to have a rhesus positive. Now, this usually will not affect the first pregnancy because it takes time for your body to be sensitized, for your body to build antibodies that can affect future pregnancies. Now, what do you do when you have a negative rhesus factor? The first step is to go and check to know your rhesus factor. After you must have known it, you should always go to your doctor whenever it is time to get pregnant or during pregnancy, earlier on in your pregnancy, to get something called Rhesus D immunoglobulin, which comes with a brand name known as Rh injection. Also, peradventure you didn't get to know your rhesus factor before getting married, and you got married to a man having a positive rhesus factor. It's very important to talk to your healthcare provider if you've had a past abortion, a past miscarriage, a past stillbirth, and so on, so that the condition will be properly managed so you don't keep on losing your child. Let's talk about the effect of carrying a baby having a rhesus positive while you are rhesus negative yourself. Now, there's high chance of having severe anemia. There's high chance of your baby developing jaundice, stillbirths, miscarriages, and so many other health conditions. Also, you need to know that having a rhesus negative blood type while your baby is carrying a rhesus positive blood type does not really affect the mother. The effect is usually on the baby. And if you are asking if this would affect everyone carrying a rhesus negative blood type, no. It will only affect if, as a rhesus negative woman, you get married to a man having a rhesus positive blood type. But that does not mean a man carrying a positive rhesus factor cannot get married to a woman carrying a negative rhesus factor. It only needs to be taken care of. You only need to get Rh injection. You only need to tell your healthcare provider in order to prevent future troubles, especially in the second pregnancy. Additionally, Rhesus incompatibility does not only affect people getting pregnant. It also comes to play in the aspect of getting a blood transfusion. So should you need to get any blood transfusion, it's important for you to know your rhesus factor, and if you have had a blood transfusion in the past without knowing your rhesus factor, it's important to talk to your healthcare provider when you get pregnant or as soon as you get married. The earlier, the better. Lastly, before I go today, before you get married, it is very important to know your partner's resource factor as well as your own. And that is all I have for you today. See you in my next video. Bye.